Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. Dr. Pane, we have a question this week from the Twitter crowd, and a person is from the Miami, Florida area. Their question is, they want to downsize from their new 425cc breast implants to 300cc, so a little bit of a downgrade. They also have skin rippling, and the skin is a bit thin, and they want to know, will this be an easy procedure? And what do you suggest?
Well, in terms of easy, we never want to call anything easy. I prefer to call things, straightforward or, unusual, something like that. In our practice, we actually welcome all sorts of unusual things, weird things, whatever someone else may not have wanted to do or told you they couldn't do, whatever. That's kind of what we do, we're kind of known for. In this case, from what I saw in those pictures, I think the person has saline implants on top of the chest muscle, but it's not exactly clear. When they lean forward, you can see some of that rippling. Now, they want to be smaller. I don't know where the specific number came up. You have 425, want to go to 300. That may be due to a friend or something like that. The options here, when you're going to go from a bigger implant to a smaller implant, oftentimes there's going to be more loose skin. And that may have to be addressed with a breast lift. And there's a couple of different possibilities depending on how much loose skin there is and what kind of scars patient is willing to accept. So this is not one we can get a definitive answer over the internet. We would have to see you in person. This person, the biggest procedure that might need to be done would be changing from on top of the muscle to under the muscle, probably going to silicone gel implants, because if you're concerned about rippling, I favor that. Although no implant is going to eliminate rippling, it's important to keep that in mind. And then potentially doing a full breast lift. That's the biggest type of operation that might need to be done. Because you're going from bigger implant to smaller implant, there's going to be extra skin to be addressed. Now, if it's not too bad, you can get away without the lift, and also depending on the goals and willingness to accept different kinds of scars. It's possible to do less than that, depending on how the tissue goes. But I would say keep in mind that you might need that maximum procedure if you have, if the skin is not snug enough. And also by changing the plane from on top to underneath, you do leave some more laxity there. So you have to weigh the rippling and how much an implant can be felt against the desire for or lack of willing to accept lift scars. Sometimes keeping the implant on top of the muscle can be okay. And I'll do it either way, depending on what's going on with the person and what they want to do in light of what I can accomplish with the different procedures. So that's how we handle it. We give you the pros and cons of the different options. Because we do the full range of everything, you don't really have to worry in our practice. We're trying to fit you into some predetermined procedure. That is not how we do it. But we try to match what you're looking for with what the different options can deliver. So we have a good match going forward and the highest chance of a successful result that will hopefully keep you set for a long time without the need for reoperations or tweaks or anything like that. Because you can get carried away with breast surgery, especially if it's not done optimally. So I hope that helps. A little bit of an involved answer like oftentimes I do, but we want to get enough information across and help you be able to make the right decision.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website, Facebook page, Twitter account, or Instagram. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.